Member for Cariboo-Chilcotin.
Well, thank you very much, Mr. Speaker. I do want to just correct one thing right off the top, and that is that we have the absolute utmost of respect for our frontline workers, unlike this member just suggested. I can appreciate, Mr. Speaker, that we have certainly different understandings of what's happening in our healthcare system and certainly different experiences dealing with the current state of healthcare in this province. It's clear that training and recruiting and retaining healthcare professionals should be a top priority for this government, given the healthcare crisis that is facing BC. We've all heard the alarming stories about the current state of our healthcare system. 1 in 5 British Columbians do not have a family doctor. BC walk-in wait times are the worst in the country, and they're getting worse every year. Chronic understaffing persists with Interior Health, the health authority that's in my riding of Cariboo-Chilcotin, reporting an increase in the vacancy rate from 5.1% in 2019 to now 13.7% in 2023. Our healthcare heroes are severely burnt out. Frankly, they're exhausted. They're forced to keep up with a workload that is unacceptable and unsustainable. This NDP government has failed them, and they are begging to receive the support that they require and deserve. But these issues are even more acute in rural communities, where the voices and realities of residents continue to be overlooked by my colleagues across the aisle. As a representative of rural constituents, I understand the harsh realities that are faced both by patients and healthcare professionals in rural BC. And I stand in this House today to raise some alarming examples of these realities. There's no clearer example, Mr. Speaker, of the state of crisis than the situation that unfolded at Cariboo Memorial Hospital last October, when a sign was posted that read, "The emergency room is closed unless a patient is imminently dying." Staff were so burnt out and overworked that they lacked the capacity to provide the necessary care to those who required emergency medical attention in all but only the most dire situations. Last summer, nurses in the Bulkley Valley District Hospital were instructed to call 911, Mr. Speaker, if their patients were in medical distress because of a lack of doctors and staff in the ER. Only 15 healthcare facilities in rural BC offer maternity services, forcing expectant mothers to temporarily relocate to give birth, paying out of their own pocket and often without their partners or families there to support them. Recent years have seen overnight ER closures in rural communities like Clearwater, Port Hardy, Port McNeill, Merritt, Oliver, Mackenzie, 100 Mile House, and for the first time ever, Cariboo Memorial Hospital, due to staffing shortages. Imagine showing up in a need of emergency medical attention only to hear that you will need to travel an hour or more to receive care. Mr. Speaker, in my area, that might be as many as 3 hours from 100 Mile or Williams Lake, but if you live in the Chilcotin, that could be as many as 6 or 7 hours away. Not to mention that the often ridiculous wait times after arriving at the ER. Think about that for a second. It could literally be the difference between life and death. Access to timely ambulance service is also a critical issue in rural BC. In 2022, an infant in Barrier died waiting for an ambulance. In the same year, a man and a woman in Ashcroft also died while waiting. This is terrifying and devastating reality for rural British Columbians. Rural healthcare workers also face unique challenges. Understaffing affects healthcare facilities across all of the province, but in rural contexts, if even one physician calls in sick, it can result in a closure and the need to divert patients elsewhere. Imagine the immense pressure this puts on our rural healthcare professionals. There are also issues of recruitment in rural healthcare professionals, given the lack of education and training programs within our rural communities. This is an NDP's new normal for rural British Columbians. It is not working. Anything that has been put forth from this government is adding more pressure and strain to this system. Thank you very much, Mr. Speaker.